Hello, I'm Lee Cowden, MD, and I'm going to give you a little information here that could be very important for your future health. A lot of people don't understand what's possible in the way of imaging the body to find out what's going on inside the body. Most people are aware of x-rays and CT scans and MRI scans, and those do serve a purpose, but the problem with the x-rays and the CT scans is that you expose your body to x-rays, and x-rays can be cancer causing. So if you can find out information in another way, that would be better. Now, one of the tools that I learned many years ago is called thermal imaging. And there's two types of thermal imaging. There's infrared imaging by camera. So a camera set up a few feet away from the patient, pointed at the patient, and you do this usually without clothing on. Maybe you have your underwear on, but you take off the rest of the clothing so that you can actually see heat coming off the body in the form of infrared energy by the infrared camera. Now, if a person has a hot area on their body, whether that's in a jawbone or in a breast, you know that there's a problem in that area. That's what we call thermal dysregulation. That means the autonomic nervous system that controls the blood flow into the area is not working properly in that area. So there's more blood flow coming into that area, bringing more heated blood into that area, which then comes out in the form of infrared energy that you can pick up on a thermal camera. Now, let's compare, for example, infrared imaging thermography to mammography. Mammography is used by allopathic medicine to screen for cancer of the breast. And we know that the probability of there being a false negative, in other words, there's a problem in the breast, but the mammography misses it, happening about 20 to 25% of the time. And we know that there's a chance of having a false positive about 20 to 20% of the time. In other words, seeing something that's there, but it's not there. So if you have a false positive test, that results in a trip to the surgeon to have a lumpectomy or at least a needle biopsy to find out what that is. However, that means that you have almost a 50% chance of the mammography being wrong. So let's compare that to infrared imaging thermography. The combined false negative and false positive for infrared imaging thermography is about 97. False positive and false negative together is about 3%, so the accuracy is about 97%. So with thermography, there's no radiation involved. With mammography, every mammogram results in a person receiving, the woman receiving, about the equivalent of 4 chest x-rays. So 4 chest x-rays is quite a bit of radiation. CT scan, however, is equivalent, one CT scan is equivalent to about 70 chest x-rays. So that's a whole lot of radiation exposure. So if you can find another way to find out the answer rather than mammography or chest x-rays or CT scans, then it's probably better for your health in the long run, especially if you're going to do this as an annual screening possibility. We know that women that get annual mammography are at greater risk of developing breast cancer than women that never get annual mammography if they have otherwise the same risks as far as family history and personal history. Okay? So that means that mammograms are increasing the risk of breast cancer. That's not a good trade-off, in my opinion. Now, infrared imaging thermography is a great tool, but there's a better tool even than that, and that's called computerized regulation thermometry. The devices that you see doctors and other health professionals using to point at a place on the skin close to the surface of the skin and getting a temperature reading off of the skin can be used in the computerized regulation thermometry. So the technician then does this temperature measurement with extremely sensitive thermal imager, and it does that on 200 different points on the body's surface. And then, after those initial temperatures are collected into a computerized database, then the patient takes off the upper garment, the shirt, the blouse, whatever, exposing a lot more of their skin, hopefully in a room that's a lot cooler than the usual ambient environment. And that exposure to the cold causes the autonomic nervous system to start adjusting to that temperature. And what happens then is you see areas in the body that were looking pretty normal, all of a sudden having what we call paradoxic response. The temperature goes up in that area when the rest of the temperatures on the body's surface are going down. A paradoxic response is a classic sign of a trouble brewing, whether that's an infection or a cancer or some other trouble brewing in that spot. So if it's on the jaw, it could represent a chronic infection in the jawbone. If it's on a breast, it could represent a cystitis in the breast, infection, inflammation in one of the ducts of the breast. But it could also represent a cancer in the breast. And as I said before, that's more sensitive by far than mammography for the breast. And you can learn information from the thermal imaging that you cannot get from any commonly used allopathic imaging procedures. Of all the allopathic tools that are used in hospitals, the one that's most likely to show something of value, more so than a CT scan, would be a ultrasound of the tissues with what we call color flow Doppler imaging. Color flow Doppler imaging looks at the blood flow going into that tissue. And if you have a ultrasound that shows increased blood supply to an area in the breast, then that's not normal. We know that cancers start developing angiogenesis. That means more development of blood vessels around the tumor that bring more blood supply into the tumor, and that causes that blood supply to show up as color image on the imaging machine with surrounding gray areas that represent areas where there's not increased blood flow. So you can actually localize cancer in the breast with ultrasound Doppler plus color flow imaging. Very, very, very few hospitals in the entire country use color flow Doppler on any part of the body other than the carotid vessels or the heart. So this is an area that you could use existing technology in the hospital to significantly improve the diagnostic capability. Over the years, I've been practicing, I was practicing from 1987 to 2019, and over those 42 years, I found many patients that had cancer that they didn't know by doing thermal imaging. And because you find cancer at an earlier stage than you would until you wait for symptoms to develop, we were able to do more, less invasive procedures and have greater success, greater survivability. So this is the key, is to make sure that you know that thermal imaging is a possibility. A lot of small towns don't have any type of thermal imaging capability. Sometimes you have to go to the bigger cities to find a place where you can do thermal imaging, but that is a better choice than the x-rays. And again, the computerized regulation thermometry, there's only one really good system in this country that does that, and that's called the ALFA, ALFA, Thermal Diagnostics. So if you type that in as a search, then you can try to see if you can find somebody that's using alpha thermodiagnostics to do a testing process. And that's a good idea to do that once a year to look for trouble before it becomes symptomatic. So again, take some matters into your own hands. Don't always rely on your allopathic doctor to know these things that I just talked about, because usually they don't know those things. So you can educate your doctor over time, and hopefully more and more doctors will take up the use of thermal imaging as a way to help their patients find conditions at an early stage. So, Lee Cowden signing off here, and hope that helps you.